Hello, and thank you once again for bringing me into your space. I'm Shauna. For those of you who don't know me, I am here to just share some education with you for management of pain and really maintenance of well-being, and in hopes to create a body that's more aligned so you can breathe, you can heal, you can feel better in this life. So, without further ado, um, I'm just going to get on with it. So, today I'm going to be talking about um, gaining control of the muscles of the head and the eyes and the neck. And really, we work right through into the trunk and really dismantling some of the unified movements that happen that really give us pain. Oftentimes, this is due to past painful situations, conditions that you've had, and then as time lapses, and we don't really rectify the situation, our our somatic system, our psychosomatic system takes over. And so we're gonna break that down so that we can move independently of each other. So the first thing I want to sort of describe to you is some really interesting clinical research that we know about. So the eyes and the neck, the head, the eyes, the neck, and the trunk are very much interconnected, especially this little area, this little C1, C2, occipital bones, the skull, and the first two vertebrae, really third vertebrae as well. These areas house what we call the suboccipital muscles, which are really important in this movement pattern and breaking up of this movement pattern. And so what we're going to experience right now is the interrelation of these muscles and the eyes. And as I speak a little bit more about them, basically these are little muscles that are sort of connect the back of the head or the skull to the neck. Their insertion point is actually sort of inside or between the vertebrae, and there's a myodermal bridge, which is just this fibrous connective tissue that these muscles connect to. And so they go, this myofascial bridge or myodermal bridge connects inside, and it actually connects to the spinal cord. So the outer layer of the spinal cord. And so if we're experiencing neck pain, splitting headaches, vertigo, where you feel like you're off balance, imbalances, off sometimes blurry vision, these are signs of a compression of the occipital nerve. And so that nerve comes up and out of that space as well, where those muscles sort of insert. This nerve comes up and it sort of branches and it reaches all the way to the top of the head. And it's just a sensory nerve, but so it's sort of sensing and feeling things. And when there's compression, when we have this head forward carriage, our head weighs about 10 or 12 pounds anyway. And so when we're in this head forward carriage, these suboccipitals are holding on tight. And so what happens is they contract. And when they contract, they pull on that myodermal bridge that we talked about, and it sort of compresses the spinal cord, really. And so the flow of cerebral spinal fluid, which is super important for the brain, for mental clarity, amongst many other things, but bringing fresh nutrients and blood to the brain tissue and whisking away the waste product. This is a very important part. The only way that happens. And so we can start to recognize the importance of having released suboccipitals, one might say, or really just muscles at a beautiful sort of somewhere between, idling between is sort of tension and relaxation. Um, and so let's just get started. So here, let's just try a little exercise. I want you to bring your hands just to the back of the neck. Right, find that little bony protuberance. You'll have one on each side, right at the back of the neck. And I want you to just sort of sink your thumbs in just underneath that. Sort of the length of your thumb, just sink underneath that. Okay? And so we're going to feel the connection of the eyes and these muscles. It's really kind of neat. So just sinking in there, and then I just want you to raise the eyes up and down, up and down. You might even want to close the eyes while you move them in the sockets, and just notice the movement pattern or the movement of those suboccipitals. Can you feel engagement of those muscles? And then move them from side to side. Often people, when I'm in clinical practice on my table, people, when I'm asking them to do this, their whole head and sometimes upper body will move as well. So now I'm moving my eyes back and forth from right to left. And again, you can really feel, and very likely you can feel maybe big head movements or just those muscles moving underneath the pressure of your thumbs. Okay, so there you go. There's evidence that these are connected with the eyes. So let's do a little exercise so we can start breaking down that unified movement pattern. Break it down, break it up, so we can have full range of motion and better articulation and flow of all the fluids of the body and necessary for vital, radiant you. Okay, so we're going to start in just a seated position, and I've got a pillow underneath my bum. I'm going to actually take that away. Ideally, you're going to be doing this without a pillow. You're going to be flat on the floor, but of course this isn't available for everyone, and we're going to be in this pinwheel pose. So I've got my right leg in front and my left lower leg leading behind me, and my right foot is coming to the sort of inside of my left leg. And then I'm going to plant my hand just down beside my right hip. So again, if this isn't available for you, you need to raise your seat. That's fine. You can use a meditation cushion or a bolster. And this can also be done on a chair. And so that's going to look like this. You're just going to simply let the legs sort of flop over. So I've got the inside of my left foot touching the ground and letting my left knee flop in towards my midline, and then my right leg on the outside of the right foot, and then letting my leg sort of drape over to the right. And then I would place my hand sort of clasping or grabbing the seat of the chair, and just make sure that you feel stable and secure here. Okay, so we're going to start with the right side. And I am only going to go through one side in this tutorial. And so do know that it's important to do both sides. And while you're doing the other side, please take time to compare. Notice differences from side to side. Notice decreased movement or increased movement and other sensations that might come up. This is the most important part of these sorts of exercises, is that we're gaining introspection. Introspection means we're feeling from the inside out, and that helps us create better proprioception. And really, this specific exercise ultimately is an exercise to regain balance and proprioception. As I mentioned before, the eyes are connected with these muscles. Of course, there's some nerve tissue that's sort of associated with the situation as well, or many. And so I like to think about, and it's a good analogy to think about the eyes as if they're the fluid in a level, so a straight edge level. And so wherever our bodies are in space, our eyes are going to create level. So if we've got some sort of weird holding pattern, which most of us do, if we don't, that's weird. So we've got these weird holding patterns in our body from all sorts of different things, experiences that we've had along the way. And then what happens is our eyes create this leveling effect. It's called the righting reflex. And then what happens with that, then our bodies start to compensate. And this is where we find chronic pain. This is where we find, degeneration of our articular surfaces, so joints and things of that nature. This is where we find visceral dysfunction. This is how we find diseases of adaptation, stress, chronic heart disease, diabetes, all of these things. This is kind of where it comes from. So proprioception, super, super important. That's what we're going to be working with primarily today, in what is mainly involved in these suboccipital muscles and the eyes, okay? All right, all that stuff aside, let's get started. So I'm going to perform this on the floor, but if you do need a chair, prefer a chair, that's fine. So to begin, we're going to bring, like I said, that right hand behind the body, and we're going to bring our left hand, just draping it across the chest so that the tips of my fingers are sort of either like holding onto the shoulder or just underneath the clavicle. And I just want you to take a rotation. Look behind your right shoulder and just rotate as far as you can. And just notice, take a moment and just sort of mark where your nose, if you took a laser right from the end of your nose, what would it mark on the wall behind you? So just take a look at the wall, if there's any spots on the wall that you can use as a measurable, okay? And then we're going to come back forward. And then we're just going to rotate a couple of times. So just light pressure on that hand that's down. We're going to rotate, turning our head and our trunk to the right, and then back to the left, or to neutral, and to the right, and back to neutral, and again, nice, and neutral, and again. All right, and then this time, I want you to turn all the way around, and you're just gonna hold here. And then I'm gonna invite you to just use the twist of the trunk to continue that rotation. And then I want you to bring your head back towards that neutral starting position, looking towards in front of you. All right, and then we're going to rotate the head again back behind you. We'll do this 5 times. And then forward, keep the rotation in the trunk. Head rotates to the right, and then forward, and then right, and then forward. And again, right. I just want you to notice as you twist right, your left hip wants to pull up off the ground. That's okay, you can let it happen. Nice, and then come back to neutral. And then we're going to twist again over the left or right shoulder, so twisting to the right. And this time I want you to just take the eyes, so keeping the head and the trunk rotated to the right, you're going to take the eyes and just shift them over so the eyes are looking to the left corner sockets. And then you'll shift the eyes to look at the wall behind you again. And then take the eyes and shift them to the left corner socket. And back to the wall. And then to left corner socket. Nice, keeping the twist in the belly. Rotation in the head. Take the eyes back to the right or the wall behind you, and then take the eyes to the left corner socket. Last time, sweep them right to left. Nice. And just come on around. All right, and then this time as you rotate, let's rotate all the way around, looking behind you. Just take a notice. Are you further? Do you have more rotation in through the head, neck, and shoulders? Now, do you notice if you were to put a laser on your nose that perhaps you've gone a little bit farther in rotation? All right, and then we're going to come all the way back around, and let's just rotate 10 times over to the right again, and just notice that hip picking up, that side body lengthening, the right side body sort of compresses. Just sort of notice As you roll back to neutral, that left hip drops back down. As you rotate away to the right, it picks up. Compress a little bit on the right side, lengthen through the left side, and come back to neutral. Just sort of notice and sense and feel those movements happening. Good. And then we're going to come back to neutral starting. Then we're just going to release some of the muscles of the neck. So we're going to take our left hand, reach it around the head. We're going to press our head nice and strong into the fingertips. Not so that we're hurting ourselves or anything, submaxillary, so there's a good amount of pressure pressing your head. So I'm pressing my head over into my fingertips like this, okay? So pressing the head over into your fingertips, and then I want you to relax the neck, and then you're going to drag the head without any resistance over to the left. Good. And then pressing the head into the fingertips, we're going to bring it back to neutral. And then releasing the muscles of the neck, we'll drag the head over to the left. And just sort of sense and feel, you can feel length through that right side, neck and shoulder region. Press again the head into the fingertips and drag the hand back to that neutral starting position, and drag it, releasing the neck muscles back over. All right, this time notice as you press the head into the hands and bring it up to neutral, sort of sink into that right sit bone. And the whole left side opens. You can feel your ribs opening, the space between your hip and your rib cage is opening. Yeah, and see if you can get a little bit more range. And then again, releasing that neck, just drag, gently guide the head over. And as you do that, notice the hip dropping down. And this time, the side body sort of compresses like an accordion. Beautiful. And as you pull the head into the fingertips, coming back to neutral, you can feel your weight shifting to the right side. Right, length through the left side and compression through the right. Nice, and then come back to neutral. And then just relax here. Okay, and just take a couple of breaths. This is a fine time if it feels right for your body, if this is a lot of work for you, especially if you have had some nausea, any of those neurological symptoms that I mentioned before, nystagma, where you've got sort of a quick blinking of the eye or sort of a movement of the eye, feeling that symptom, or painful headaches or dizziness or imbalances. Just lie down here, pause the video, take a moment to let everything sort of integrate into the body. So on your back body, knees up, feet on the floor. Okay. And then if you're going to continue on, are almost done with the exercise routine. So we're going to plant that hand down just like we have before, and then the left hand is going to come beside it. Okay, so I've got my hands planted right and left beside each other. And so what I'm going to do, I'm going to actually shift my body so that you can see a little bit better how this looks. Okay, so here I am with my hands planted beside each other. And I'm going to rotate my rib cage over, like I'm looking over to the right. Okay, so I'm rotating over to the right with my head and my trunk and my eyes. And I'm just going to rotate back. And I'm going to sweep and rotate as though I'm looking just at my shoulder level. Okay, not above, not terribly below, just right at my shoulder level. And same when I sweep back and look to the right, I'm just sort of bring my cheek close to my shoulder, looking about that shoulder level. We'll do this a couple of times back and forth. Rotating, sensing, feeling the ribs and the head and the neck. Notice any other sensations that are happening. And remember, you're going to compare this to the other side. Good, so we'll go one more rotation through. One more rotation through, good. And we're looking over to the right here with the trunk and the head and the eyes. And so I want you to, this is your starting point here. And now we're going to keep the trunk rotated to the right. Actually, sorry, this is not our starting point. You're going to keep the rotation to the right in the trunk. And I just want you to take your head and rotate it to the left. Now this might be tricky, so we'll take your time. With all of this, take your time. And if there's any pain or discomfort, just come out of it. Okay, there should be no pain or discomfort. All right, so my trunk is rotated to the left or right, and my head is to the left. Okay, and now I'm going to simultaneously, I'm going to sweep my head over to the right, and I'm rotating my torso to the left. Okay, and you can go ahead and put a hand on your rib cage and rotate your rib cage to the left, and then rotate your head over to the right. Okay, just as a guide, not as the actual exercise as you move forward. This is just a helpful guide to create those synapses, to create those circuits. All right, and then again, we're going to guide the ribs over to the right and bring the head over to the left. Good. Guide the ribs over to the left, head over to the right. Okay, now you have the movement in the body. Okay, you should be able to bring both hands down. If you're not quite there yet, that's okay. Continue practicing. Rotated trunk or ribs to the left, and my head is rotated to the right. Okay, let's do this 3 more times together. So we're rotating the head to the left and the ribs to the right. And ribs to the left, head to the right, ribs to the right, head to the left. Good. And ribs and head to neutral. Okay, both hands are still planted down beside each other. Last movement pattern of this nature. We're going to take the eyes and bring them into play. So we're going to rotate head, neck, and eyes over to the right, just like we started with. And then we're going to just take the eyes to the left. So sweep the eyes over to the left corner socket. And again, rotate the head, simultaneous, and the trunk to the left, and let the eyes sweep to the right. Take your time. Trunk and head over to the left, eyes to the right. Take your time. Breathe. Take the tongue to the roof of the mouth. Find nostril breathing if you can. Rotate trunk and head to the left. Trunk and head, sorry, to the right. My apologies. Trunk and head to the right, eyes to the left. Evenly distributing the weight between both hands. Breathing, bringing the tongue to the roof of the mouth. Trunk rotates to the left, head rotates to the left, eyes sweep to the right. Nice and slow, find control, find easement in the movement. Trunk and head to the right, and sweep the eyes to the left corner sockets. Trunk and head to the left, eyes sweep to the right corner sockets. Nice, we'll go one more time. Trunk and head to the right, eyes sweep to the left corner sockets. Nice. Release. Come on up. Take a moment for that to integrate into the body. And once again, if it feels right for you, make your way down into a constructive resting position, which is this. Lying on your back, knees up, feet flat on the floor. I mean, this is lovely for anyone, but certainly if you've got some really deeply grooved patterns in your body, which we all really do, take a moment just to allow the recalibration of the spine to integrate that new education into the body. Breathing a few breaths here. Maybe for the last part of a movement practice. Beautiful. So let's find our way back into that pinwheel posture. Excuse me. Rolling onto your side. Just gonna take a sip of water. I'm getting over a little cold. I have lots of congestion still. Okay. So once more, we're gonna plant both hands. Right hand down by our hip, left hand beside it. And this time we're going to really work with those eyes and suboccipitals, although we have been the whole time. So we're going to bring our eyes, our head and our eyes up to the sky. Okay, and then we're going to bring our head and our eyes down to the floor. Head and eyes up to the sky and down to the floor. And again, head and eyes up to the sky and down to the floor. One more time. Head and eyes up to the sky and down to the floor. I'm going to come back to neutral. So this time we're going to go head and eyes up to the sky, and we're going to now sweep the eyes down to the floor. And then we're going to drop the gaze, the head down to the floor, and the gaze up to the top of the eye socket. As though we're looking up to the sky. And then we're going to bring our head up and let our eyes sweep down. And then head down and eyes sweep up. Take your time, move slowly, be compassionate with yourself. These are actually quite difficult movements to coordinate in our bodies. I've been doing it for some time. Okay, looking up with the head, sweep the eyes down. As you look at the floor, bottom sockets. Drop your head, raise your eyes up to the sky. And last one, eyes down, head up. And come back to neutral. And then we're going to come back around into the seated pinwheel posture. We're going to plant our hand once again, bring our left hand just across the chest. And let's go again and rotate all the way until you can't rotate anymore. And take a moment to check in with how much rotation how much range you've increased. Have you increased your range? And how does it feel in your body? You should probably feel a little bit of suppleness. There's probably a few things that are calling your attention as the body starts to sort of reintegrate, like I mentioned, and let go. It will take a while. So this is a simple movement practice. Of course, it takes longer to explain it in a tutorial, but as you practice and move through it a few times, it's a simple 5-minute, 10-minute, max 10-minute practice that you can do in the morning, ideally. First thing in the morning or later at night is always a good time to integrate these sorts of exercises, these re-education exercises where we're working with the neurological system like this. Just because our bodies are a little bit tired, they're sort of more open to receive, if you will be. So yeah, thank you for your time and trusting me with your bodies, with your soul vessels. There's lots of information that sort of correlates with this particular exercise or movement pattern. And so if you are interested in more of the nitty-gritty of it, of the science behind it, feel free to message me or leave a comment. Otherwise, if you do give it a go and you're finding some results with it, again, please share that information. It's always wonderful to hear people finding relief and just a more vibrant, healthier life. All right. Thank you for your time. May you breathe, feel, heal better in this life. Peace in.